drains we will review are the urinary catheter, chest tube, surgical drains, and others. The urinary catheter is used to collect urine. You always want to ensure the collection bag is below the bladder. You also want to ensure the catheter is secure. Sometimes it may have a stat lock or some other stabilization device. There are different types of catheters. There are external as well as internal catheters. For patients with a penis, you may encounter a condom catheter. These frequently fall off during mobility, and you may need to ask the nursing staff to help reapply. There are also external catheters for patients with vaginas. These are connected to suction, and you should remove them prior to mobility. The two types of internal catheters are the Foley and the suprapubic. These are secured with the balloon in the bladder, and you want to call the nurse immediately if these are dislodged. A fecal management system is typically used in patients with excessive loose stools in order to protect the patient's skin. When mobilizing these patients, you want to avoid shearing with transfers to maintain the integrity of the line. These lines are held in place with the balloon in the rectum. If it's dislodged, notify the nurse immediately. Chest tubes are used to drain air, blood, or fluid from the pleural space. There are different types of insertion, pleural and mediastinal. Pleural can be mid-axillary or mid-clavicular, and mediastinal is typically right in the center. When a chest tube is being removed, if it's in the pleural space, you want to make sure you're checking a chest x-ray prior to mobility and monitoring oxygen saturation levels as opposed to a mediastinal removal. Chest tubes have a collection chamber, sometimes known as an atrium, which must remain upright and below the draining site. You want to avoid kinks in the tubing, and you want to make sure you don't have dependent loops that are fluid-filled. It is important when you're mobilizing these patients to monitor their respiratory rate, their oxygen saturation levels, as well as their lung sounds. These may be connected to suction as well. If it's not connected to suction, lots of times you can just mobilize the patient and not have to worry about a specific order in place. If it is connected to suction, you would need to check if it's okay to mobilize the patient on water still, that is, you can remove it from suction, or if you need to mobilize the patient on portable suction. Some facilities may have portable suction so that you can still mobilize the patient even though the patient needs to remain on continuous suction. If this is dislodged, you want to cover the area with your hand, apply pressure, and call the nurse immediately for assistance. Gastrointestinal or GI tubes are used to drain GI contents or to minister feedings or medication. These are inserted in the nose, mouth, or abdomen. They can be short or long-term. If a patient does have a GI tube, you want to make sure you turn off their feeding if you're going to be lowering their head less than 30 degrees, and that's just to prevent any risk of aspiration. If this is dislodged, you want to immediately alert the nursing staff for assistance. When you're working with a GI tube, there's lots of different nomenclature you may encounter. So short-term GI tubes may be referred to as an NG, which is nose to stomach or gastric, ND, which is nose to duodenum, or NJ, which is nose to jejunum. The gastric or G tube is inserted directly into the stomach, and these are used for long-term purposes for patients who may require long-term feeding. The GJ is gastric to jejunum, and a PEG tube is a specific type of procedure in which a flexible feeding tube is placed through the abdominal wall and into the stomach. So that again is for long-term use. And then lastly, there's the jejunal or J tube, which is inserted directly into the jejunum. There are many different types of surgical drains that can be placed during surgery to drain pus, blood, or other fluid to prevent it from accumulating in the body. There may be active drains or passive drains. Active are those that are driven by negative pressure. Passive drains just simply channel fluids from one place to another. There also may be a closed system, which means the contents are not exposed to the atmosphere. So vacuum systems such as the Jackson Pratt are active drains, and non-vacuum systems such as a pigtail drain are mostly passive drains. Then there's the open system, which does communicate with the outside atmosphere. All of these are non-vacuum, such as a Penrose drain. You do want to ensure drains are secure prior to mobility. These may or may not be sutured. so you may need a safety pin to prevent migration or secure it in some other fashion. If a surgical drain is dislodged, cover the area with your hand, apply pressure, and call the nurse immediately. A wound vac, or vacuum-assisted closure of a wound, is one type of closed active drainage system used for wound treatment. It provides negative pressure wound therapy to promote healing in acute or chronic wounds. It's commonly used on skin flaps or grafts, ulcers after debridement, and surgical closings. A ventriculostomy, or EVD, measures intracranial pressure and drains cerebrospinal fluid. There's an indicator line or light that must line up with the external auditory meatus for accurate readings. Research has found that mobility is safe and feasible with these drains in place. You do want to ensure a secure connection prior to mobility. In most facilities, the goal is to maintain the intracranial pressure less than 20 millimeters of mercury. This must be clamped by the nurse prior to mobility, and you are unable to get an ICP reading during mobility. It is life-threatening if dislodged, so you want to call the nurse immediately for assistance. There are different types of breathing tubes. One is the endotracheal tube, or ETT. This is for short-term mechanical ventilation through the nose or the mouth. You do want to note the level of the breathing tube, typically by measuring it prior to mobility, and that's just so you can recheck it after mobility to make sure it hasn't moved at all. You want to call the nurse immediately if this is dislodged. You may need to ventilate the patient with a bag valve mask in the meantime. Another type of breathing tube is the tracheostomy. This is inserted below the vocal cords for long-term ventilation. This does allow a bit more ease for mobility because it's more comfortable for the patient. It also improves oral hygiene for the patient, and it may allow for speech and nutrition. There is a precaution for a patient with a fresh trach. It does take about 5 to 7 days for a well-defined tract to form between the trachea and the skin, so you want to use extra precaution during that time. Call the nurse immediately if it's dislodged, and again, you may need to ventilate via a bag valve mask if the patient is requiring oxygen. In summary, drains are in place to collect air, blood, or fluid to prevent the accumulation of those fluids in the body. You want to assess all drains and attachment sites prior to mobility to ensure the drains are secure and will not dislodge or pull on the patient. You also want to reassess drains post-mobility to ensure dislodgement of drain has not occurred. Ensure drains are free of kinks and are properly positioned below the level of the insertion site to facilitate proper drainage. And some drains can require urgent care if dislodged, so ensure you have adequate training.